Hello, I'm Emma Hammett from First Aid for Life and onlinefirstaid.com. Today I want to talk to you about something I think is really important, how to manage your medication. A lot of people think this is very simple and you just do what the doctor says. However, there are 1.15 billion prescriptions every year, and they've just announced that they have worked out there's about 237 million drug errors. So that's about 1 in 5 of the medications prescribed that may not be quite right, and that has serious consequences. Most people are fine, but it can cause major issues. People being left on medication too long, people having delays for medication, people having the wrong medication because lots has different names, slightly different spellings, and mistakes happen. We've got a really hard-pressed NHS at the moment, and unfortunately when you're working heavily under pressure, we are all human and mistakes do happen. So I just wanted to give you a few tips and understanding as to how to manage your medication and how to make it less likely that you're one of those 1 in 5 that might end up taking the wrong medicines. So the most important thing is to be actively involved and understand the health conditions that you have and why you're being prescribed. If you find it all a bit daunting, write it down when you go to the doctors or take somebody with you. It does make a difference. The key thing with medications is you want the right medicine, and medicines have some very complicated names. You've got the generic name and then you've got the brand name. And again, they are quite similar, but they may do very different things. The other thing to understand is the dosage. So what you're trying to do is to take your drug so that you are actually ingesting it when it's got its maximum effect and potency. That's why it's 2 times a day, 3 times a day, once a day. It depends how fast it breaks down, and so consequently the best way to have it in your system. That's why if you have trouble swallowing pills, you shouldn't be crushing them and mixing them up in liquids, because the way the pill is made, very often they are coated in something that means that it won't start actually being broken down by the body and metabolized until it gets to a certain point in your body. If you've crushed it down, you've changed the way that drug will behave. So never do anything like that without checking first with the pharmacist that that's okay. Have a medication list. This is particularly important if you're on multiple medications, and include anything over the counter or anything that you might take because you enjoy. Be mindful as well that sometimes foodstuffs can interact with medication too. Grapefruit is an absolute classic, and it can affect the absorption of certain drugs. It can even affect the absorption of the contraceptive pill. And certainly a lot of other medication, and things like broccoli and stuff. My mother-in-law was prescribed thyroid pills, and actually it turned out that she was overdosing on cabbage. And when I got her to cut down on the cabbage, she no longer needed the thyroid pills. So do look at the whole side of things and the diet and everything, and see if it could be interacting too. So be actively involved, make sure you understand what you're being prescribed, and do not be frightened to ask. So ask, do I really need this medication, and what am I being prescribed it for? On your medication list, you should have the name, the exact spelling, the purpose, and whether it's a brand name or generic name. Make sure you know about any side effects or drug interactions and what to do if they occur. And you need to go and tell your GP if there is anything unusual happening when you're taking that medication. And make sure you keep those lists so that if they try and prescribe you the same medication again, that you are able to remind them that you had side effects last time. Make sure you know how and when the medication should be taken. Should it be taken on an empty stomach? Should it be taken with meals? Should it be taken in bedtime? How long it's to be continued, and if any blood tests are required, or if there's any monitoring. And also what to do if you miss a dose or you forget a dose. How to store the medicine, should it be in the fridge at room temperature, and any interactions with alcohol or anything else that you're taking. So please ask them and read the patient information leaflets carefully as well. If they're too small for you, you can sometimes contact the drug company and they can issue you larger print ones. Particularly with older people, the metabolism tends to be a bit slower, so drugs may not be broken down as fast, so they will sit in the body and the bloodstream longer. Your kidneys might not be working quite as well to clear them, and so consequently drug interactions are more likely. So generally with older people, they may need to start with a lower dose and then titrate upwards. I hope that has been helpful. Please ask, please don't not be in awe of the doctors. They're quite happy to tell you and to be questioned about it. And don't always expect to have a prescription given. I heard the other day about someone who got prescribed antibiotics for a septic finger. You can treat a septic finger by hot salt water and magnesium sulfate paste and bring it to a head. Clearly, if it's got horrendously infected, then you may need antibiotics, but this wasn't. So sometimes medication is given to fob someone off. So medication is serious and it's very helpful, but make sure you're taking it in the right way and make sure you're being involved in the decisions. So thank you for listening. That's Emma Hammett from First Aid for Life and onlinefirstaid.com.